Good morning, everyone. This is Debbie Durako, Senior Director of StellaLife Vega Oral Care. Today, I'm here to teach you about our oncology applications of StellaLife. What we'll cover in this conversation is why StellaLife? What's the science behind it? Some of the procedures and applications with our oncology patients. How do you incorporate it? What are some of the new topics such as probiotics and Denomedica, and how it can elevate the quality of your care? We have many, many people that have reached out to us through Trustpilot or trusted resource of giving us high accolades on how this helps our oncology patients, not only with dry mouth, but also with healing wounds that occur when they go through oncology procedures like chemo and radiation. We're also being taught in multiple universities, including none other than Loma Linda, University of Chicago, and many others. We're also being taught postgraduate training courses in the dental community. So, what is StellaLife? StellaLife is a powerful integration and natural approach to being able to control the oral microbe. Our rinses have antimicrobial and bacterial static capabilities, but what is unique is that they are very stealthy. They target certain pathogens while leaving more of your commensal bacteria alone. We also have gels that create an anti-inflammatory accelerated wound healing process because these products do not harm fibroblasts, but rather accelerate the rapid movement to wound heal. And our recovery kits are a combination therapy of our rinse, a sublingual spray, and a gel. The other additional products that we've introduced to the oncology world are also a supportive system of nutrients. We introduced Denomedica as a complete nutritional support system for patients to boost their vitamin D levels, which in turn helps with immunity and wound healing. We also introduced a probiotic that is not just an oral or just a gut, but a combination cure of oral and gut probiotics. So, what is the science behind StellaLife? One of the first universities to bring science to wound healing was Bern University, an amazing technologically advanced school that not only teaches medicine but also dentistry. What they wanted to understand better was what was happening. Were these wounds healing so much faster? And what they looked at were fibroblasts. And as you can see in this study, that we looked at the fibroblasts being a green, active, alive fibroblastic activity. And the traditional model of care to control bacteria has been chlorhexidine, but we knew there were side effects to that. And it's demonstrated in this study how rapidly chlorhexidine can kill those fibroblastic cells that cause the wound healing. We were looking for resources and an opportunity to do something unique and different. And we've demonstrated how important that is with StellaLife Vega Oral Care to not only keep fibroblastic activity alive, but accelerate the wound healing process. So, of course, you can't have one study, you need to have more than that. So, the University of Texas did several scratch test studies on our products. And what you can see is that good old salt water, not too shabby, allowed the fibroblastic activity to stay alive. However, you can see these little fibroblasts coming out in a normal pace. But when you compared it at the same time point to chlorhexidine, you can see where there actually is absolutely no activity and a wide open wound. But here's where StellaLife stood out. Not only did the fibroblast actually come out of the tissue, but it accelerated that activity to close the wound faster. This is called accelerated wound healing. And the last study that was done on wound healing came out of Indiana University, finding exactly the same thing, that StellaLife Gel was the only product tested in this group that not only was bacterial static, but also did not harm fibroblastic activity. Rutgers University also did a study looking very deeply into bacteria. And what's important in the oncology patient is that we maintain an oral microbial balance. So, what we discovered with this were particular pathogens like FN and PG were not only killed, but killed for long periods of time while being the least toxic to commensal good bacteria, which is extremely important to maintain in the oral cavity. Not only that, we discovered that we were actually able to disrupt biofilm colonization, making it easier for your patient to be able to remove biofilm through brushing, flossing, and other mechanisms of action like water picking. This in turn should help our oncology patients maintain a better oral microbial balance. Here's an example of a long-term study with a pemphigus patient. This came out of Loma Linda University. This is a 3-year study with using our recovery kit and coconut rinse. We did understand better that coconut rinse has more added ingredients to create a more soothing effect on the tissue while not introducing mint to the oral cavity, which for some of these patients can be very sensitive. So oral patients who are just actually going through these kind of procedures will actually benefit from coconut rinse as a very good wound healer. Also, just as a side note, our rinses not only are antimicrobial, but they're also bacterial static for long periods of time. It's important to note with natural products how they are manufactured. And StellaLife has taken several steps to make sure that these products are safely made in a GMP approved manufacturing facility. That means good manufacturing practices. All the products are tested for microbial kill rates as well as bacteriological rates, and they're monitored by the FDA. So not only the manufacturing facility, but also the laboratory testing is monitored by the FDA. Another added benefit of using StellaLife products for your patients is the problem that they have often with multiple abscess ulcers. And what we've learned is that StellaLife gel, comparing it to a product called Magic Mouth Rinse and even laser treatment, beat out the ability to wound heal by days. With StellaLife gel, it only took 2 to 3 days, while the Magic Mouth Rinse and our patients who were treated with laser took about 10 to 14 days for complete wound healing. Why is that? Well, if you understand the mechanism, is that our gel not only is an antimicrobial, it's also an anti-inflammatory, and remember, it's accelerating fibroblastic activity, allowing the patients to heal faster. Our recovery kit is a 3-part system: a rinse, a sublingual spray, and a gel. It's used simultaneously and it's used in conjunction 3 times a day for these types of patients. Ideally, we like with our oncology patients to start this protocol at least 3 days before treatment for radiation and chemotherapy, allowing the patients to have an opportunity to have a very good oral cavity before these treatments are completed. Here is an example of a patient who has an autoimmune condition called lichen planus. This is 1 week without steroids using our rinse and gel combination. And for our mucositis patients, which we often see this with chemotherapy and radiation, this is a 1-month recovery using our system. We also paid a lot of attention to pain management. One of the most important things we can do in dentistry is to allow our patients to have less opioids. And that was a very big mission of ours at StellaLife. We're able to accomplish this by not only accelerating their healing process, but really controlling the inflammation, which in turn controls pain. And this has been a published study in the Journal of Oral and Maxillofacial Surgery. The other common problem with a lot of our oncology patients is dry mouth. Medications and just in general, the environment can become very dry. And we know how important it is for our saliva and the job it does to protect our oral cavity. StellaLife has things in it like xylitol topically that help moisturize, as well as remember, we're killing strep mutans and P. gingivalis and FN and so many of the bad pathogens while being least toxic to the good bacteria. So allowing patients to use this on a daily basis will help them with their dry mouth as well as being able to destroy those bacteria that are causing problems for them. One of our doctors, Dr. Dennis Abbott, who practiced in Dallas for many years, worked as an oncology dentistry. He worked often with the universities and high-level oncology practices to help prevent these side effects, and his comments are powerful. He noticed that when patients were using StellaLife, that it actually, in a lot of the cases, were able to prevent oral mucositis. And very encouraging to be able to have things like this that are made out of plants and minerals, safer for our patients to be able to use and create this kind of wonderful environment for them. The last thing I want to share with you are some of the new things that are on the forefront of being able to manage our patients in a very unique way. StellaLife realized several years ago that there were root causes to a lot of the problems in the oral cavity coming from the gut. So what we did was we designed an oral and gut probiotic. What makes it extremely unique is that not only did we introduce prebiotics, which are food to keep the probiotics alive, but also postbiotics, which are also nutrients that are given off by the probiotics to help them stay alive longer. We also used a spore, which makes it easier to maintain longevity in the stomach acids. And we added a few extra nutritional support systems like vitamin C, D, and zinc, harvested and developed from very unique resources. What we know about probiotics are the strains that make it so unique. When you look at the strains that StellaLife choose that happen to be patented, they're allowing you to actually control things at a whole nother level. You are actually being an antifungus. You're also being able to inactivate perio-pathogens, reduce the strep mutans that cause decay in these patients, as well as disrupting biofilm all on their own. And in addition to that, anyone on an antibiotic should be able to use probiotics quickly to rebuild the good flora. And in our dental world, you can see the evidence of how powerful this can be in a typical patient that has gingivitis, which we often see in these patients who are going through chemo and radiation. It is very easy to take. You're only taking it once a day. You're swallowing a capsule and you're sucking on a lozenge. Nothing to eat or drink for about 20 minutes. And lastly, today, what I wanted to share with you is a unique support system that was originally developed for implant patients. But what we discovered along the way of developing this product was that it had so many other applications. In the dental world, when our oncology patients have completed treatment and maybe going through restorative care, often we've noticed that vitamin D levels were very, very low. These studies that are in full on our website identify that one of the main factors that contributed to implant failure of bone integrating was low vitamin D levels, and not just a little bit, extremely low vitamin D levels. What we created was a very comprehensive nutritional support system. Not only does it have A and C, but it was uniquely resourced with D3 coming from lichen, not sheepskin. We've also added K and E because without those, you cannot get D3 to work. All of the B vitamins, and really important, the minerals that are critical to our bodies in the success of being able to increase the ability to grow bone around these implant patients. They also can take this 4 weeks before and 2 weeks after. As you notice, they were loading doses. They can maintain this product long term by cutting the dose in half and taking 2 a day. Very easy to swallow because they are vegetarian-based capsules, also made in a GMP facility, which means that what you see is what you get. 4 weeks before and 2 weeks after, as I mentioned, is ideal with no other supplementation taking at that time because they are, in fact, loading doses. I hope we can help you and your oncology patients to have less oral challenges during the time frame that they're going through chemo and radiation and the side effects that occur, such as dry mouth, in supporting them and being able to create better wound healing, improving their lives, and managing their oral discomfort at the best levels we can. I thank you for joining my program today, and I look forward to your questions.